Hi everyone, my name's Rhonda. I just want to do a quick video and introduce myself and tell you who I am, why I'm here, and why I'm doing this. So by training, I'm a nurse. My specialty was surgical nursing. As I was a surgical nurse and we did a lot of amputations. People would come in for the surgery, they're having yet another amputation, and we do the pre-op and we check their blood sugar and their blood pressure, and their blood sugars would be too high and their blood pressure would be too high, and even though they were there because they were sick and had elevated blood sugar, we couldn't do the surgery. We couldn't remove yet another toe or another foot because they were too sick. And I thought, wow, we've got to figure out a better way to do this. Why aren't we letting people know 30 years earlier what they can do to impact their health? Our healthcare system was just broken, and I didn't have any control to work from the top down and fix it. But I thought, but I can certainly help the individual from the bottom up. And by doing that, I created this company called Weltrio. I worked with companies, and we were able to reduce the cost of their health insurance by helping each individual get better. And we did that with one-on-one training and coaching and education, and preventative care, and helping people understand why their health got that way, how it got that way, what they can do about it. Help people understand that they're not stuck. That so many times I would have a client come in and they would say, look, there's nothing I can do. I'm diabetic, my mother was diabetic, my grandmother was diabetic, and my kids will be diabetic. And I would be like, oh my goodness, I am so sorry that nobody's given you hope. There is so much we can do to reverse this disease, and I am going to help you. And then we would reverse their diabetes. We never cure it, but you can put them into remission, you can get them off of their medications. And I realized that by helping the individual and working from the bottom up, that we could return the dollars that we're spending in healthcare back into the pockets of the individual and back into the pockets of the employers who are paying for this insurance. So my training is a nurse. I'm an RN. I have a bachelor's degree in nursing. I also have a master's degree in nutrition education, and I've done some additional training. I'm a health and wellness coach, board certified. The thing I'm most proud of is I'm a mom. Been married for almost 34 years, and I have 5 children. My youngest is going to be 21 this next week. And then 4 years ago, my sister died unexpectedly and suddenly, and I inherited her 5 kids. So, and they stair-step in age. So my youngest was the same age as her oldest. So now I have 5 new kids that I'm raising with my husband. And that's what I am. That's who I am. That's what I do. And ultimately, I became interested in health because of my children, because I knew there was a better way. When I had 2 little girls who would get ear infections all the time. Like, they would be off of antibiotic for a week and boom, they have another ear infection. I remember bringing home what felt like a gallon of pink bubblegum antibiotic and stuck it in the fridge because the pediatrician wanted to keep my daughter's ears from being infected long enough so that they could do surgery. I'm like, surgery? Like, I don't think my child is deficient in antibiotic. And this was a long time ago, but I did all the research I possibly could, and I changed her diet, and I changed what she ate, and I figured out that she had some sensitivities to food that had not been considered. And when we took those foods away, she didn't have to have that surgery, and she didn't have to take that antibiotic. So that's not the case for everybody, and there is certainly a time and a place for antibiotic, and for medicine, I believe it's critical, but there's things we can do. We don't have to be stuck in the situation that we find ourselves in. I hope you watch some other videos and learn about the how and the what and the why and the what you can do about it and how you can help you and your family and your health so you're not stuck in the current health situation you find yourself in.